Strategy and Insider, exploring future trends and their impacts.
Hey everyone, thank you for tuning into this very insightful conversation with Nora Blum from Selfapy, which I'm sure is worth listening. We had already recorded this episode at the beginning of March, which is why we have actually been co-locating in beautiful Berlin at the time. And given the circumstances of COVID, we decided to postpone this episode a bit to help shed some more light on COVID-related discussions. But enough of introduction, have fun and enjoy. Hi everyone, welcome to the Strategy and Insider podcast, where this season is all about the future of health. My name is Thomas Solbach and I'm a partner at Strategy and in our pharma and life science practice and the host of this podcast. Together with different healthcare experts like academics, practitioners, entrepreneurs, and also executives, we do explore some of the most critical future trends and challenges within the healthcare industry. And at this stage, already a big thank you to everyone, to your loyalty and support. And we do really appreciate your interest in our conversations and discussions that we're having with our interview partners. And no matter if you are a regular listener or found this podcast for the very first time, we actually appreciate that you're tuning in, as well as the very nice feedback and the good ratings that you've gotten us so far. And if you didn't find the time yet, obviously, we would highly appreciate that. Today, I'm really thrilled to welcome Nora Blum. First of all, thanks very much for making the time and for being our guest here in this episode today.
Of course, thanks for having me.
Hey, for everyone listening who don't know Nora yet, she is a psychologist and the co-founder of the startup called Selfapy, which is a guided and self-help online course that does provide care to people with things like depression, anxiety, and eating disorders. But I'm sure we'll have a deeper discussion with Nora throughout the conversation. And prior to doing this, Nora did study psychology at the University of York and Cambridge and has worked for the venture builder Rocket Internet in the past. And actually in 2017, she made it into the Forbes 30 under 30 list for social entrepreneurs, saying about herself that she is passionate about being using technology to make psychology care basically better and also available to everyone at reasonable costs. Without any further ado, again, welcome to this podcast, and let's dive right into the conversation, Nora.
Cool.
Hey, psychology, to me at least, being a non-psychologist, is to me a very broad field that does encompass basically the study of human thoughts, which is super complex, and not only thoughts, but also behavior and how you develop and what your personality is around and your emotions, how they come up and how you motivate and much, much more. You decided, after obviously doing your school, that you go to York and the University of Cambridge in the UK, studying psychology there. A, why did you study psychology? And B, why did you go straight into the UK?
Interesting question, and also thanks for the nice intro, Thomas. Very happy to be here, so thanks for that. Psychology, for me, it was actually always clear that I wanted to study psychology. There was no question in my head about it. I actually grew up in a family of mostly psychotherapists and psychoanalytics.
So you kind of had a legacy to deal with here.
Yes, I had. That was actually the number one topic at the dining table. It's the topic of our family. Everyone is a psychologist.
Okay.
So for me, it was always the most interesting topic that there is, and I honestly sometimes ask myself, how can anyone not study psychology, as it is so interesting, and it tells you why people behave the way they do, and why would you not be interested in it? So for me, I always wanted to become a psychologist. Okay. Yes, definitely. And why the UK? Oh, I don't know. Sometimes I ask myself that. After my baccalaureate, I come from Hamburg. I wanted to just experience a different country. I wanted to study somewhere else. I wanted to improve my English. And for me, UK seemed like a good place, and especially York and Cambridge, both universities that have a college system. It's a bit different to study in the UK, where you're really part of the university, and the university basically is part of your life. You do sports, you have your friends, everything is related to the uni. And for me, I found that was very interesting, and especially Cambridge is such a beautiful place.
Yeah, very vibrant, but also very traditional.
Yes.
And it
was crazy.
A lot of great ingredients there.
Yes, you do. You meet so many great people, and it was really one of the best times of my life. Yeah.
Cool. And after finishing this, you first decided to go to Rocket Internet and work on various angles there, also running the Hamburg office for Foodora at the time. But then you kind of switched back into psychology and founded your own thing. What made you kind of reorient towards that?
In the beginning, during my studies, I was mostly focusing on clinical work. So I was working in psychiatric hospitals and...
in the UK then? Still?
Yeah, partly in the UK, partly back in Hamburg. So during summer break, I was always working in psychotherapy practices. I was always working in psychiatric clinics. And I did my first work experience in that field. And I thought it was super interesting. And I liked the work, but I always knew that I didn't want to become a psychotherapist and work as a practitioner in the first place, because I always was also interested in experiencing another field of work, which is a bit more, like I felt a bit younger, more vibrant in a way. And I had friends that were working at Rocket Internet and they told me about it, and I thought it just seemed like such a cool place where so many young people, ambitious people get together and get a lot of responsibility very early onwards and can actually shape future in a way. And for me, I felt that was such a cool place to work for. And also I have to say, I was always wanting to do what I do now. Selfapy as a venture, combining venture building as well as helping people with mental disorders was something that I was thinking about very early onwards. During my studies, I already met my co-founder, Kati. She's also a psychologist, and already during that time, that was back in 2013, 2014, and we were already talking about building a platform that provides people with mental disorders easy access to care. And during that time, it just seemed logical that we would separate and that she would work in the Charité clinic and that I would work for Rocket Internet that teaches you how to build a company.
And with you having worked both in the UK and Germany, are there any differences on how we as care systems do approach psychiatric disorders, or is there no big difference?
I'd say the UK is a bit further with regards to online therapy programs for mental disorders. Germany was a bit backwards in that sense, especially during that time. We had nothing really that helps people to get immediate access to care. But in general, I feel the problem in the UK as well as in Germany, as well as actually it's a worldwide problem, that people with mental disorders are not treated the way they're supposed to. They don't get help immediately. They have to wait for months and months. And this is the same in the UK as well as it is in Germany. And it's still a stigmatized topic. It becomes better, but still people with depression, people with anxiety, they don't approach psychotherapists as people do with the broken arm, you know?
Yeah, it's not something very natural, and people are kind of hiding away with it, right?
Exactly.
But that, to my understanding, is also one of the reasons why you and your co-founders did actually found Selfapy. And as I was saying at the very beginning, I tried to summarize what Selfapy is in a sentence, but if you would characterize Selfapy, who you are and what you do, how would you describe it for everyone listening here?
So with Selfapy, we want to give people easier access to mental care. What we do is we developed online therapy programs that teach users the principles of cognitive behavioral therapy. So it's kind of working like an e-learning tool, which teaches you the principles with help of videos, audios, exercises. And you do these exercises and you basically learn how to make yourself feel better. And during this 3 months course, online training course, you always get guided by a psychologist. So you always have a person to talk to, and they give feedback on what you do during the online course. And they talk to you either in form of chat or by telephone. And with these 3 months programs, you actually get the same results as you do with traditional psychotherapy.
Okay.
So it can be very, very helpful for people, but it has the positive effects that it's very flexible, so people can do it from their own home, and it's immediate, so people can sign up within minutes and get help.
And also sign off within minutes if they don't like it, right?
Yes, of course.
Which is also a positive side to it.
Yes.
I'm not joking here, but this is also in psychiatric diseases is something to also keep in mind, and I would see that actually as a benefit to the program. And do you have your own psychologists in-house then, or do you collaborate with psychiatrists from universities and in hospitals and private clinics, or how do you do that?
We have our own psychologists in-house.
Great.
We have a pool of roughly 60 psychologists that work for us, and they get supervision from our lead psychologists, and they guide the users through the course. Yeah.
Interesting. Hey, and you successfully founded, obviously, and big congrats, of course, to achieving another round of substantial financing here, talking about something in the range of 5 to 6 million euros in funding. Can you share a little, what was kind of the biggest challenges? I mean, what's important to keep in mind when founding a startup in the healthcare sector in Germany?
Well, a couple of years ago, I would have said, just don't found a startup in the mental health care space because it's so difficult. No, it's actually very difficult. It's very difficult in Germany to get a business model that works for you. That's the main topic, because there's no real self-pay market in Germany. People don't really pay for treatment themselves, just because our healthcare system works the way that, well, you get most treatments from the health insurances, right? So people wouldn't actually pay out of their own pocket for it. But then again, you need the health insurances to pay for what you do, and that is a very long way. So it took us roughly 3 years to get the first contracts with health insurances. We have 16 contracts now, which is quite a lot of partners that already pay for our therapy, and that's actually how our business model works. But it just took us a long time.
And those are kind of selective contracts that you have on a one-to-one basis with the individual.
Yeah. Okay. And we have over 100 health insurances here in Germany. So for me, this was a long time of just driving around from health insurance to health insurance, from city to city, to pitch what we do, and that our program works, and that we want them to pay for the therapy and not have the insured people pay for the therapy. And that took us a long way. Yeah.
This is now kind of currently turned by current government and Jens Spahn, who recently introduced something that would reward health startups in the digital space to get, hopefully at some point, an easier access to reimbursement, talking about the digitales Versorgungsgesetz, as we would call it in Germany, and translating it into English, it's something like the Digital Healthcare Act, that now allows statutory health insurance companies to basically reimburse certain health apps even without that selective contract that we have been talking about. But in order to kind of qualify to make it onto the list of reimbursable apps, there are certain hurdles to keep in mind. And me personally, coming also from the healthcare system side to a certain degree, I would judge that as rather complex, the way to get onto that list. If I see there is something in the range of 120 line items to tick off around the functionality, around safety, quality, data security and privacy, and also the associated evidence that you need to generate through, at some point, cost-intense studies, do seem like a proper hurdle for highly innovative, agile, yet smaller companies like Selfapy and others. How do you see that personally?
Yeah, it's very complex. That as a start. No, in general, I'm obviously the biggest fan of the new law. I think it's a very great initiative.
Yeah.
If I had a poster on my wall from someone, it would be from Jens Spahn.
Cool.
Literally, I am the biggest fan.
Have you ever told him?
I see him a couple of weeks and I might tell him. No, I without jokes, I love the new law. It's awesome because what it does for us as a startup, for example, is that all these thousands of patients that we get each month that we can't help because their health insurance isn't covering our program yet. We have to send them away. So basically what we do is that we do the same as the psychotherapists that have this very long waiting time. It's the same with us. Like, we can't give them any help. And that's because their health insurances don't pay for it.
Unless they're self-paying then, which is obviously a burden to a lot of people, right?
Usually they don't, yeah. But this is now changing with the new law. So in the future, these patients can now go to see a doctor and they can actually get Selfapy prescribed. And for us, obviously, this is a game changer because we can actually now finally help all these people that we want to help, that want to use our program, but don't want to pay it out of their own pocket. So it's a big thing. I think it's also a big thing for Germany in general, which we're usually regarded as one of the least far countries with regards to digitalization, especially in the healthcare systems. So I think this is a huge step for Germany as a country, and it's a huge step that will allow patients to get support in different areas with digitalization. And I think this is it's a super great thing. And for us, obviously, as a startup, it's awesome.
Yeah.
It's awesome.
And it's truly kind of a leapfrog step. Even for the German healthcare system,
it's crazy.
Right?
We're now
overtaking the rest of the world with regard to digital health.
Yes, exactly.
Where, I don't know, 6 months back, we would have not made such a statement by any means, right?
Yeah.
So it is a big step. At the same time, it brings some need for expensive studies, right? And that's why you also kind of fundraised, as you recently did, that you are, if I understand correctly, already still in a study that you're doing in collaboration with the Charité here in Berlin, and publishing date, what I can see at least, coming soon. Can you shed some light on how difficult it is, and where do you see that going? Yeah,
it is difficult to become part of the law, which I think makes sense because it's money from the health insurances that we're spending, and not every app and not every online program should be eligible to be part of this care system, right? So it makes sense. There needs to be a lot of requirements with regards to data security, with regards to clinical evidence, with regards to quality management. It's a lot of certifications that you need, which are just costly. And I do think though that they make sense, but as you said, there's like an 80 pages long catalog of different requirements, listing all the requirements, and it is a very costly thing to achieve all of them. For us, we have always been a startup that for our health insurance contracts that we already have, we always had to work on all these different requirements. So we have already a very strict data security process. We already have external data security audits and all these kind of things. We're already getting the first audit now for our quality management systems, etc. So we are already, I'd say, quite far in this process. Still, there's a lot of stuff that we still also need to do. And with regards to the clinical evidence, so the way the law works is that you can actually get into the new law with just some minor evidence. I personally actually think it's a bit too low. But you can work under the new law for a year and then have to show. That's kind of
your grace period, right? Until you show the evidence.
Exactly. Yeah. But we just finished the second clinical study. We get the results in the next weeks together with the Charité, but they're already looking very good.
Keeping fingers crossed for that. Yeah. Great.
Yeah. Obviously, apart from clinical trials, what we do is we always look at our data. It's the most important KPIs for us. So in a normal startup, you would look at sales, you would look at, I don't know, at return rates or anything. But what we always look at is the symptom reduction. So we always optimize our program based on how many people get actually better. And obviously we know that the people do get better. So the clinical trials are just there to validate that from an external partner. And we're starting our studies now with regards to other programs. So with regards to anxiety and eating disorders with the university in Heidelberg, for example. And we will use these clinical studies then also to get the evidence that you need to get reimbursed under the new law.
And do you also get some real life kind of evidence and feedback from actual users that are coming back and say, hey, Nora, or whoever they're approaching within Selfapy, great that you did that, and this helped change my life and reorient myself.
Yeah, we get a lot of that. That's actually the main reason why we keep on going and why we do what we do, right? Because founding a startup in the healthcare space is not easy. It's been really 4 very tough years, and we're very, very proud actually of what we have achieved so far. But this is mostly because we actually can help the people and we get this awesome feedback. And this is what keeps everyone in our team really going, because this is not a normal user group. We don't have users, we have patients really. And when your program works well, it means that they actually get better, and they send you these amazing long letters and comments that because of our program they can leave the house for the first time, or they have got back in touch with their family, or that they can actually go back to work. And this is something that's obviously amazing, and this is really the major drive that everyone on our team has.
And you not do that in kind of a normal disease area where you reference a broken arm or kind of headache or whatever, where there is kind of a proper explanation and understanding of root causes to things. And in psychiatric diseases, there is still that kind of stigma and also somewhat of an intolerance in society towards those mental health disorders. Why do you think those stigmata or intolerance do actually exist, and why don't we have the same attribution of relevance to these diseases like a broken arm?
Well, I think it's getting better, especially in Germany. So people are more likely to approach a psychotherapist, but still, as you said, it's still stigmatized. I think it's something that you can't see. That's one of the major problems. So it's not something where you can see, of course, obviously the bone's broken. So that person cannot use the arm anymore. But it's something that is inside. So it's very difficult for other people to actually make sense out of it, right? And the other thing is that is often associated with weakness still, which I think is very, very sad, because as it is associated with weakness for people that feel sad and that have feelings, and this is still attributes that that are associated with often female types actually, and with weakness. And this is why people don't really want to go outside and say, I have a depression, I have an anxiety disorder.
So just jumping on what you just said with regard to it's getting better here in Germany, and also coming back to the Federal Ministry of Health, that actually states that depressive disorders are among the most common, and also in terms of their severity, most underestimated diseases that we're experiencing as society, and that it is actually estimated that about 350 million people worldwide suffer from depression at the moment. And according to the WHO, depression or any affective disorder will be amongst the most common and widespread diseases worldwide by 2020 and beyond. How do you think your technology, but also other technologies that you're seeing emerging in this field, can actually help recognize signs of mental disorders at a very early stage, that people are not kind of locking themselves away in their houses and get into such a stigmata or whatever it is that hinders them to live a normal life? How can kind of technology and early preventative measures do something good here?
I think there's great approaches going on to see early signs of mental illness. These are approaches often actually in the US, some approaches I think also in the UK, that want to collect different data from smartphones with regards to how the person moves, actually also voice recognition, what kind of things the person types on Facebook, on WhatsApp. So they collect all data, and they want to build a alert system basically that tells the user when they feel when their situation is about to get worse. I'm actually not sure whether they actually work yet that well. There's been some programs that can show that there's obviously an effect between, say, doing exercises and how much the person talks to other people with their phone, and how much he's moving around, which correlated with mental illness. But I'm not sure actually whether there's already a program that can actually tell the person and then have an effect on it.
And I recently had a very interesting discussion with someone, and we came to the conclusion that in way earlier days of medical history, at the time where we didn't know that cells actually exist, until there was kind of the microscope found and innovated. At that time, we then understood that there is not only cells, but also compartments in cells, and even in compartments, you see another proteins and microbiomes and what have you being present there. That we came to that conclusion that the kind of data and the associated analytics could be the microscope of the 21st century, because if we only understand what are the parameters that we're reading out in terms of the heart rate, sweating behaviors, walking behaviors, flattering in your voice, whatever it is, or combinations of that are predictive of an onset or a worsening of a disease, then we understand what to look for, right?
Yeah.
And for the time being, to me, it feels like there is tons and millions and billions of bytes out there, but we don't know what is relevant and what not, right?
Yes, that's true. Yeah, I hope to see some more awesome approaches that actually want to make sense of all this data that is already out there to prevent some of the mental illnesses, but illnesses in general, right?
And how do you see the chances of preventing this? Because if I take the broken arm example, of course, that is something that you can prevent. If we take type 2 diabetes, through better exercise, more healthy nutrition, you can prevent this. Yeah. How do you see chances also in mental illnesses to do prevention properly there?
I think there's a lot that society can do. I think there's a lot that can be done, especially like not looking at data and startups now, but for example, to bring programs into school to teach young people already the principles of resilience, for example, and how can they help themselves in phases where they're unwell, when their parents are unwell, how they can basically make themselves feel better. And I think there's a lot of things that can be done already in early ages onwards, which is not being done at the moment, which I don't really understand, to be honest, because it's such a costly illness, mental illnesses are. And I do think that there's a lot of things that can be done. I think, though, that it's not something that can be avoided altogether. There will always be people that are more prone to mental illness. There will always be phases in life where people don't have the ability to bounce back from these life events. And I think there always remains the necessity of people being there to help these people.
Yeah, sure. And I'm intrigued by also digging a little into how you, as the kind of new entrants into the healthcare system, kind of cope and collaborate with the traditional players in the healthcare system. And I can only imagine when running these studies, when having these dialogues around reimbursement, and also at the intersect of the traditional, sometimes drug-based therapies versus the digital therapies, as Selfapy is one. How is that interlink, that interplay, and also the collaboration looking like between yourselves and big universities, big payer organizations, or even big pharma companies? I mean, they're huge, right? They have people and staff for every angle of the traditional healthcare system, where you come in with only a couple of handful of people doing something good for patients there. How is that collaboration, and where are the challenges for you in these interacts?
Well, it depends on which partner you look at, right? Psychotherapists in the beginning, they were quite skeptical of what we do, and I think this is very natural, and that's the way they're supposed to be. But by now, they really understand what we do. The ones that we talk to, they see that we're there for patients that, well, not ready yet to approach them and to actually see someone face to face. So I feel like our collaboration with psychotherapists has improved a lot. With regards to doctors, it's a good collaboration. They know that there's such a long waiting time for people with mental disorders to receive care. So they're very helpful for anything that gives their patients help straight away. And this is why we keep in touch with doctors as well, especially now with the new law needing them basically for a prescription. So they become more important to us, and I think also we can become more important to them, and in working together. With regards to pharmaceutical companies, we do some projects with them, but it kind of depends, because it really depends on the player. Our focus is at the moment mostly on working together with health insurances, and we do very much appreciate these collaborations. Yeah.
You're currently primarily focusing on the German market, and of course, when treating people with psychiatric diseases, obviously they would need to express themselves in their local language, right?
Yes.
How do you see that from a internationalization or scalability point of view? How can you? What are your kind of visions and thoughts around that?
Yeah, we're at the moment very much focused still on the German-speaking countries. So we do have collaborations with Swiss health insurances as well. Okay. So we have some projects going on there. But as you said, it's not as easy to internationalize for us, because it's not an app that you can just like translate the contents and that's it.
Exactly.
Because we do have psychologists actually standing behind there, and we feel like there's also changes in the content that you need to make when you go into another country because of cultural differences, for example. So it's not as easy for us to just internationalize. We do feel though that there is the need, and there's so many other countries that have the problem that we have in Germany, with very long waiting times, with very big difficulties for people to receive care. So we do want to internationalize definitely from 2021 onwards, but this year we're definitely focusing on the getting reimbursed under the new law.
Sure, I mean, getting it right first in the German-speaking area, but then having a kind of a next step into international markets. But I can only imagine people will want to talk in their mother tongue when it comes about feelings and these very sensitive aspects.
Yes.
It's not like just buying DVD that you can do in English.
It's very difficult. It's a very sensitive topic. Even our customer support say they're all psychologists, right? Because they're not doing just the normal customer support. Everyone in our office really is a psychologist, because with every point of contact that you have with the patients, you need to be careful with what you say and with how you speak, and it's always you're always working as a psychologist in a way. Yeah.
And talking about the people that you're approaching, the patients that you're helping with Selfapy, obviously not only in mental health, but more broadly. There is thousands, if not hundreds of thousands of different health apps out there, obviously number growing as we speak. And obviously for people that are in kind of need for something and search for something, for them it's at least a jungle to guide themselves through, obviously fostering uncertainty at their ends and hesitation on whom to trust and whom not to trust. Now, you being at the frontier of developing those, what would you kind of suggest or recommend to people how to best find the app or the combination of apps to help themselves?
Yeah, I think with the new law, it should get easier to distinguish the apps that have done their homework with regards to data security and quality. So only apps that actually have evidence that have all the certifications, this will be the apps that will be certified and that will be reimbursed under the new law. So I think this is for patients a very good hint that there is quality behind it, and also for the patient then obviously way better because they can actually get the app for free. So this is one thing. And then I think another thing is always to look at the institution partners. There's so many apps that are not collaborating with any institutional partner and that don't work actually with psychotherapists or doctors together at all. They just want to make money, and usually their programs are not that good.
The medical evidence and robustness is probably sometimes missing here.
Yes, definitely. But you do usually notice it when you look at them, and they usually don't have a partner like the Charité that they work with, and they don't usually have clinical evidence. So these are the things I would look out for.
Cool. If we would meet up again in, let's say, 10 years from now, and healthcare has advanced in mental diseases as well as other diseases, what are the biggest surprises or the biggest leapfrog changes that we will have seen in those 10 years, if you could kind of estimate?
Yes. Well, I do think that telemedicine will be huge. I don't think it will be normal anymore for patients to go into the doctor's practice and wait in the waiting room for hours, getting ill possibly. I think it will be very much more common to see a doctor via the video. That as one thing, I think, and I also hope that obviously mental disorders will also be treated in parts, obviously still with traditional psychotherapists. They always will be the main and the key players, but also that online programs as Selfapy will be one of the programs, and just seen as a traditional way, as an alternative way to receive care, actually. And this, with regards to all different illnesses, I think there will always be one option to go to see someone face to face, or then the alternative option to get treatment via an online program or via an app.
Cool. So, Nora, thanks very much for shedding those lights and kind of giving a bit of experience in terms of how you founded Selfapy, with which kind of remit and ideas, and how you see that going forward. To me, it was very refreshing to see that kind of the user experience or the customer satisfaction with that is your main currency,
Yes.
which is something superb. Second, to me, it was very good to see that digital is not everything, but can be a very good mean to make a change, because you combine digital elements with very analog elements, where you have psychologists, and digital is not everything, because it needs to be, especially in human medicine, needs to be transmitted via a human whom you can trust and talk to and have a relationship with, even if it is via telemedicine, but there is someone whom you can trust. And also your perspective on you're being one of the stakeholders that are contributing to people's health, and you do that kind of more in a roundtable collaborative approach with universities, with pharma, with payers and alike, where there is a bridge building between the traditional and the new world. So thanks very much for this. For everyone listening, also to your ends, thanks for staying on. And if you want to find out more of our latest thinking and latest reports, please go to our website and download accordingly. With that said, again, thanks very much for staying tuned, and have a great day.
Strategy made real.